Hello and welcome to the Midwife Says, where I share evidence-based facts about women's health, pregnancy, birth, and postpartum. My name is Melanie, and I'm almost a licensed midwife in the state of Florida. Today, I wanted to discuss a topic that is probably the number one most asked question in prenatal visits, and that's abdominal pain in pregnancy. I will discuss 3 different types of abdominal pain in pregnancy, so be sure to stick around to the end because some of them might surprise you. There are several different types of abdominal pain in pregnancy, and first and foremost, I want to be clear that this is not medical advice. So if you're having concerns, please reach out to your provider or go into the hospital. The first type of abdominal pain in pregnancy that probably comes to mind is contractions or Braxton Hicks. Braxton Hicks are usually painless and are often a tightening of the entire uterine muscle because the uterus is just that, a muscle. These contractions don't have the rhythm to get a baby out. These are simply to keep the uterus towards the body rather than letting the uterus hang towards the floor. Contractions that should catch your attention are painful cramping in the abdomen that is becoming longer, stronger, and closer together and do not go away with rest or hydration. If someone were experiencing the latter and is not at least 37 weeks pregnant, they should reach out to their provider or go into the hospital. Abdominal pain felt in the upper right quadrant of the abdomen, kind of in the rib cage area, can be concerning, especially if this is in combination with a headache, visual disturbances like blurry vision or spots before the eyes, and if the person has had a history of high blood pressure. If someone had a combination of these symptoms, they should go into the hospital right away. This is a sign of preeclampsia. I will do another video on preeclampsia in the future, but this is dangerous and it can escalate very quickly. And finally, the number one most common cause of abdominal pain in pregnancy is round ligament pain. Comment below if you've ever heard about round ligament pain or experienced round ligament pain. I want to know your story. If this is not your first pregnancy, you've probably heard of round ligament pain. If this is your first pregnancy, you'll probably continue to hear about it if this is the first time. You can think about the uterus as a hot air balloon. It's tethered to the basket by ropes, just as your uterus is tethered to your pelvis by ligaments. As the hot air balloon gets blown up, those ropes are pulled tighter and tighter until eventually the ropes are the only thing holding the balloon to the basket in midair. It's the same idea. As your uterus grows, more tension is placed on those ligaments that keep your uterus anchored to the pelvis. Round ligament pain can be severe, and it's usually in the lower abdomen on either the left or right side. It can present on both sides at once or on one side at a time, usually depending on how you're moving. The telltale sign for me that lets me know someone is experiencing round ligament pain is when they complain about a lower abdominal pain that's on the side and presents mainly when changing positions, rolling over in bed, or after being up and around for a long time. The best resolution for round ligament pain is to use a belly band. I will link a few below that I've seen clients have success with. Essentially, the role of the belly band is to remove some of that strain off of those ligaments. It helps to bear some of the weight so the ligaments don't have to do all the work on their own. Therefore, less tension and less pain. The amount of videos that I could create on pain in pregnancy is endless. So if you have any specific questions or would like to know more on a specific subject, please let me know in the comments below. I post every single Tuesday, Thursday, and Sunday, so be sure to tune back in for Sunday's video all about back pain in pregnancy. Or if you're watching this at a future date, you can check the links below for that video. Thank you so much for watching. Take care of yourselves, and I'll see you next time.